continuing to stay on top of coronavirus numbers. For the first time since the pandemic began, the death toll in the United States surpassed 4,000 in just one day. This goes along with more than 274,000 new cases, which is the second most on record. Experts warned that things would get worse this winter, but many hoped with the news of 2 authorized vaccines, things would turn around. There has been so much flaw and confusing with the rollout process, which is putting us behind.
There's obviously a huge demand for these vaccines, but people have a hard time understanding where do I go to get it? Where do I stand in line? There hasn't been a lot of communication. The states haven't been equipped to be able to handle this.
Additional funding for vaccine rollout was included in the $900 billion COVID relief package that was signed last month.
Early research is suggesting Pfizer's COVID-19 vaccine can protect against that variant we've been hearing when it comes to the virus. University of Texas researchers used blood samples from 20 people who received the Pfizer-BioNTech vaccine. Antibodies in those vaccine recipients successfully fought off the new strain, at least in lab dishes. And while the news is considered overall reassuring, they say much more research is still needed. You know, the demand for COVID vaccines across Southwest Florida is very high. We show you that all the time. And it's true across the nation, but 2 hospitals in Oregon had to toss out their shipments of the Pfizer vaccine in the garbage. It's about 42 total doses that ended up in the trash. One reason is because of broken vials or incorrect shipment, they say. The other reason is because the vaccine has to be given within 2 hours of thawing out, and there were no employees of the hospital available to take it during that time period. They've been finding they're actually being given more vaccines than they're actually needing at the moment.
Of course, we're taking a look at mental health during this pandemic, and in California, the COVID surge is taking an emotional toll on hospital nurses. The holiday COVID surge has resulted in record hospitalizations in that state. As a matter of fact, just yesterday, California's health authorities reported 583 new deaths and a record 2-day total of more than 1,000 deaths. Some nurses there say it's the worst that they've ever seen.
This past week has been probably the hardest week for me physically and emotionally as a nurse. I've been here 21 years, and I've seen more people pass away in the past week, in the past couple weeks really, than I almost like it combined in all of my career as a nurse. It's been really hard physically and emotionally.
Refrigerated trailers continue to serve as makeshift morgues, especially in Southern California. Hospitals are under new orders to limit non-essential surgeries, and some hospitals must accept patients from hospitals that have run out of ICU space. Also in California, colleges with a new take on COVID-19 testing. Look at this. It's a new vending machine at the University of California, San Diego. Now, instead of dispensing candy bars, it's giving you a COVID-19 test kit. The kits are free, and they allow students and staff on campus to test themselves. Each kit actually contains a swab and a vial that, once used, can be dropped off on site within 72 hours. Over the last few months, many students and staff were making appointments to get a test done by a nurse on campus. But students say this is way more convenient for their lives.
I was uncomfortable at first, but then after doing it a bunch of times, I got used to it.
20th time since I've been here. I'm not lying. We get tested every week.
Vending machine is way more accessible, and especially like if you have something to do and it's like you have like 5 minutes to go do something, like come right here and get it.
Testing on the go. The school says it plans to eventually stop the in-person testing method altogether and make this the new normal.